Welcome to Garden of Fertility. I am Opera Stella Thelma, your fertility counselor. Today we are going to be talking about how to tell the difference between implantation bleeding and miscarriage. But before I proceed, I would like you to subscribe to my channels, turn on your notification button so that you'll be notified anytime I upload a new video. To my regular viewers, I say thank you. If you are pregnant, vaginal bleeding is always worrisome. Implantation bleeding is not usually a cause for a concern because this implantation bleeding looks like a light period. However, it will be very difficult to differentiate implantation bleeding from miscarriage. Other causes of bleeding in early pregnancy can be as a result of ectopic pregnancy or infection. And this can be very dangerous. So, it is very important for you to differentiate implantation bleeding and miscarriage, so as to seek medical attention on time if you are experiencing any form of bleeding. So, what is implantation bleeding? Implantation bleeding occurs in the earliest time of pregnancy. It appears as a dot of blood in the underwear or toilet paper few days or after the first positive pregnancy test. Implantation is the attachment of the fertilized egg in the wall of the uterus. It usually occurs 10 days after fertilization of eggs. At this point, small bleeding or spotting may occur as a result of this fertilization. Implantation bleeding usually occurs close to the due date of your monthly menstrual period. For these reasons, implantation bleeding may be mistaken for extremely low menstrual flow, especially on those who usually have a very low menstrual flow. So, there is no need to worry about implantation bleeding. It does not affect the formation of the egg or the fetus. Similarly, the absence of implantation bleeding is not a problem, and there is no need to worry. It is important for you to realize that it's a sign of pregnancy, not your menstrual period. Once you notice that you are pregnant, you can stop the activities that can affect the development of the baby, such as smoking, taking alcohol, or medications that will affect the development of the child. Now, what are the differences between implantation bleeding and miscarriage? So we are going to take it one after the other for you to be able to differentiate miscarriage and implantation bleeding. Bleeding when you are trying to conceive or knowing that you are pregnant can be worrying. Sometimes it can be confusing to differentiate implantation bleeding from early miscarriage bleeding. In general, the bleeding that is associated with imminent miscarriage or no pregnancy at all may start with spotting. With time, it may increase to heavy menstrual flow. And this bleeding comes with visible clots, dark red color, cramps, and tissue passing through the vagina are also the symptoms of miscarriage. On the other hand, may appear as a brown or a light color without a clot in it. It is a light flow that lasts few hours to few days. Now, I know you can be able to differentiate a miscarriage and implantation bleeding. So, implantation bleeding doesn't come with pains, it does not come with any clotting or heavy flow. I know you find this section informative. Please don't forget to like, share, and comment on this video. Thank you for watching.